Good morning, everyone, and welcome to the webinar, Can a One Health Approach Tackle the Silent AMR Pandemic? My name is Ginevra Jesse, and I work as a policy officer at Healthcare Without Harm Europe. In this webinar, we will explore how the One Health approach can be meaningfully implemented to address one of the most urgent health threats of our time, antimicrobial resistance, or AMR. We will take a closer look at how collaboration across the human, animal, and environmental health sectors is essential to tackle the spread of AMR. In particular, we will also reflect on the role of the environment, an often overlooked but critical link that connects the different areas where AMR can develop and spread. Before starting, a couple of quick points from me. Please note that this webinar is being recorded and will be available on this page shortly after the event is ended. Please use the live chat tab in the panel to the right of your screen to add any comments, or the Q&A tab to send questions to our speakers. Please specify who your question is for, and we will aim to put it to the speakers at the end of the webinar. So, to set the stage for today's conversation, I would like to briefly introduce our latest report, titled Tackling AMR in the Environment, How the EU Can Lead the Way. This report was developed to evaluate the environmental aspects of the European One Health Action Plan against AMR, offering specific recommendations from an environmental perspective. But why this report? Let's take a moment to zoom out. As many of you already know, AMR is a growing global health threat. In Europe alone, it already causes 35,000 deaths every year, with economic costs exceeding 1.5 billion annually in healthcare and lost productivity. While AMR is often seen as a human or animal health issue, the environment also plays a big role, but it is often overlooked. Indeed, there's still a lot we don't know about how antibiotic pollution affects the environment and spreads resistance. To truly tackle AMR, the EU must strengthen its policies and take a one-health approach, linking human, animal, and environmental health. This report had 3 key goals. Firstly, to highlight the environmental dimension of AMR, which are still too often neglected in policy discussions. Secondly, to evaluate the European One Health Action Plan against AMR from an environmental perspective. And finally, to offer concrete, cross-sectoral recommendations for implementing the One Health approach more effectively in Europe. Understanding how antimicrobial resistance AMR spreads in the environment means looking at the sectors most responsible for driving the resistance in the environment. The key economic sectors contributing to the environmental dimension of AMR are, firstly, the pharmaceutical and chemical manufacturing. This includes the production and use of antibiotics. If waste from these processes is not properly managed, it can contaminate the environment and promote resistant bacteria. Then we have agriculture, or food production. In animal farming, aquaculture, and crop production, antibiotics are widely used. These substances often end up in the environment through manure, runoff, and farm wastewater. And finally, healthcare delivery, where hospitals and pharmacies use a range of antimicrobials, which may enter the environment via untreated or poorly treated wastewater. So the environment in this context acts both as a reservoir for resistant bacteria and as a transmission route, spreading antimicrobial resistance through agricultural runoff, wastewater, and pharmaceutical waste. So let me briefly highlight some of our key findings and gaps in how the environmental dimension of AMR are currently addressed. The overuse of antibiotics in humans and farming is a major source of pharmaceutical pollution and poses risks to ecosystems. One Health training remains limited. Indeed, most healthcare professionals receive little education on AMR's environmental aspects. There is still a limited environmental focus in EU AMR strategies and actions, as they rarely include environmental actors or data. Surveillance of AMR in the environment is weak compared to human and animal health. Also, there are a few standardized tools or systems to monitor AMR in soil, water, and ecosystem. Awareness campaigns often overlook the role of the environment in AMR transmission. And finally, the environmental sector is still poorly integrated into national action plans on AMR across the EU. But to address these gaps, the report proposes several recommendations. First, monitor antibiotic residues in EU water to include the relevant antimicrobials. Secondly, to improve animal health conditions to reduce antibiotic use in farming. Then, to prioritize environmental surveillance, developing standardized monitoring protocols. Fourthly, to incorporate the European Environment Agency and the European Chemical Agency into drafting interagency reports, such as the JACRA report. Then, very importantly, to raise awareness of the role of the environment in AMR transmission and acceleration. Support the full integration of the environmental sector in national action plan across the EU. Ensure environmental experts are included in EU-level AMR networks and action. And finally, develop and implement harmonized and comprehensive One Health education and training across the EU. So, as the report underlines, AMR does not respect sectoral boundaries, but it flows across different sectors like human health, animal health, and the broader environment. In particular, the environment plays a critical role as a connector, linking the various domains where resistant bacteria emerge, persist, and spread. So if we want the One Health approach to be more than just a concept, we must integrate environmental health alongside human and animal health in both EU-level policies and national actions. And that's exactly why we are here today. This webinar brings together voices from different sectors, including public health, animal health, pharma manufacturing, healthcare, and the environment, to explore how we can make the One Health approach truly operational in our fight against AMR. Each speaker today brings a distinct perspective and area of expertise, and the goal of this conversation is to foster dialogue across those perspectives, identify shared challenges, and explore how we can work together towards more coordinated, integrated, and practical action on AMR. With that, I'm very pleased to welcome to the stage Eric Ruiz, Safer Pharma Program Manager at HCWH Europe, who will moderate today's panels and provide the environmental perspective for our discussion. Thank you very much, Eric. Over to you.
Thank you, Ginevra, and thank you very much for this overview that you did of the topic that we are going to discuss today, AMR, its impact on human health, animal health, but also the role of the environment as a connector. We saw that obviously the main reasons for antimicrobial resistant spread and development are basically the use of antibiotics, which are needed both for animals and for humans, but in some cases we know that there is an overuse, which leads to antimicrobials and other pharmaceuticals entering the environment. And today in this webinar, we have a few experts from different disciplines with the idea of discussing the impact of AMR through a really One Health lens. And for that purpose, I will start introducing and calling some of the different speakers to the stage. So we have, for example, with us today, Peter Almos, who is a Vice President at the Standing Committee of European Doctors. We have also with us Andrea Caputo Svensson, who is Global Health Advisor at REACT. We will also welcome Nancy de Breen, who is the Executive Director of the Federation of Veterinarians of Europe. And we have with us also Mirka Sokolovic, Director General at the European Public Health Alliance, who will join in a second through our platform. We are having some technical problems, but we are going to fix them very soon. And just to start with a very general question, now that all of you are here and we are setting a bit the tone, I would like to ask you one of the tricky ones. Like, what do you see that is the most urgent challenge to tackle AMR right now? And I will start with Peter, if that's okay with you.
Yes, thank you very much, and good morning.
Welcome, Peter.
Thank you for inviting to the stage, and good morning for all the audience. So CPME conducted a survey back in starting in 2020, and what we found is that the survey was about antimicrobial stewardship and public awareness, And what we found, and what is kind of concerning, is that the actions to manage AMR at national level remain highly inconsistent and uncoordinated. So what we think is that we need a better, more effective cooperation, and the role of the EU is vital to do this. CPME itself adopted a policy on AMR in April 2023, and we highlighted that the importance of stewardship, communication, and prudent use of antimicrobials are the important cornerstones to fight against AMR. So what we think the most urgent challenge now is the lack of coordination. We need an EU level coordination of the national actions.
All right, thank you very much, Peter, and welcome Milka on stage. Finally, we have solved our little problems, technical problems. Well, same questions goes for Nancy, who, as I said, she's the executive director of the Federation of Veterinarians of Europe. What do you see as the most urgent challenge when tackling AMR?
Well, good morning, everybody, and thank you for the invitation. From the veterinary perspective, we believe the most urgent challenge remains to ensure that unnecessary antibiotic use, both in humans and in animals, is reduced to the minimum, while ensuring that we still keep access to antimicrobials when we need it. So how can we do that? Well, from the animal side, mostly on investing in preventive measures, in vaccination, biosecurity, hygiene, improved housing, improved feeding, and so on. So there we think lies the biggest opportunity to fight against AMR.
Thank you very much, Nancy. Andrea, you are next in line.
Thanks, Eric, and I also want to thank you for inviting us. And inviting
I think you are muted.
Can you hear me?
Yes.
Okay, excellent. So I was thanking you and your organization for inviting us to this important stage with other esteemed panelists. To answer your question, I'll take a different, perhaps, direction and say that AMR itself, it is the challenge, right? So it's in itself, it represents a challenge. If we think about, first of all, I would say, when it comes to the narrative and how we talk about AMR, I think that's the first type of challenge, because for many years has really been seen as a very technical and medical type of issue, which it still is. But in order for expanding and making sure that different sectors, including the public and the civil society, really gets on and understand the gravity of the issue, we need to make sure that we use also language which is understandable by many. Also, staying on the narrative side, I think it's important to make a distinction between what is AMR, so antimicrobial resistance, and antibiotic resistance. And I'm saying that because when it comes, for example, to data, even with the GRAM study, which is those big study that have been bringing up the burden of antibiotic resistance, that was specifically about antibiotic, right? And not antimicrobials, as more broader. So also there it's important to refer to the right data using the right terminology. I would also say, as was mentioned before, that access to effective antibiotics still remains a bigger challenge. And as you know, REACT works globally, and we know that in low middle income countries, access to antibiotic is still a huge issue that we need to solve. And perhaps last but not least, I will also mention sustainable funding and financing, because today we're also discussing, of course, One Health towards AMR, and it's important that when it comes, for example, to national action plans, which we'll mention before by Geneva, it's important that those national action plans are actually funded, which is one of the commitments within the UN declaration from last year. But I'll stop there. Thank you.
And thank you very much for raising that topic, Andrea, because we are going to go through that declaration in a couple of minutes. But first, I want to ask Milka also about this. So, Milka, please go ahead.
Thank you, Eric, and thank you for providing this platform for discussion, and also thank you for the opportunity to bring in the public health view into the discussion. Honestly, I think that the biggest challenge is that we still treat AMR as someone else's problem or tomorrow's problem. And I think we need to internalize that it's happening here and now, and that it affects everyone, especially the most vulnerable. And I would build on what Andrea was saying regarding the evidence. I don't think we lack the evidence. I think we lack political will, we lack systemic accountability, and we lack investment, as Andrea was saying, in public goods like health literacy, like in environmental stewardship, like diagnostics. So I would just close by saying that AMR is a classic case where equity, environment, and economy meet, and public health ends up absorbing the cost, both human and financial. Thank you. Over to you, Eric.
That's a brilliant point. It's even like an end of conference point to make. I want to pick up on something that you said, and you said that AMR is here right now, and I think it's a message that should be the core of also this conference. Like when we discuss about AMR, it's not something that we don't know if it's going to happen. We cannot see the trends. We know that it's happening already. So I wanted to ask you, what are the most pressing consequences of AMR right now? And probably Peter would like also to jump in right afterwards, but which are the most pressing consequences of AMR?
Right, thank you. Well, yes, you say we speak as if it's an upcoming something. We're talking about a silent pandemic. It's not silent, it's roaring. And the fact is that people think of AMR as something abstract, but it becomes really very real when your child can't get effective antibiotics after surgery, or when your grandmother faces a resistant infection that no longer responds to treatment. And we are already
I think that we cannot see Milka, right? Or is it just me? No, I think she's gone. Well, Peter, if you want to jump in, I have the same question for you. Like, what's the most pressing consequence of AMR right now?
So we doctors, obviously, we see patients suffering from the consequences and dying. So we lose them, many of them, or they have residual deficit after successfully battling an AMR, infection. What we think is, and what we see, that 80% of doctors acknowledge that they are aware that their individual prescribing patterns impact the spread of resistance. But in some countries, there are no clear guidelines, or these guidelines are not monitored well enough. So, as I mentioned previously, CPME have adopted a policy on AMR in April 2023 about, and the most important thing is the prudent use of antimicrobials, also antibiotics, because without that we cannot be successful. Which is really crucial is to stop preventive use of antibiotics, which is and we need the One Health approach for this. So it's not enough if only doctors act on this topic. So I think of course, as doctors, we should find the appropriate compound, the appropriate dose, and, for example, point of care testing is really crucial to be better in antimicrobial prescription.
All right. Thank you, Peter. I don't know if Mika, you want to end your intervention as well?
Yes, thank you. Apologies for the perks of technology. So I'm sure that Peter was already talking about the consequences in terms of the longer hospital stays and more treatment failures and higher mortality. But I would say from the public health perspective, the real sting is in the fact that the AMR hits the most vulnerable the hardest. So people living in poverty, migrants, marginalized communities, they are already dealing with poorer access to timely care, overcrowded housing, unsafe working conditions. And then when you add resistant infections to that mix, the consequences are devastating. And I would say, despite the rhetoric around One Health, we are still not walking the talk, because basic public health interventions like sanitation, like vaccination, clear water, decent housing, they are rarely planned together with action in agriculture, food systems, or environmental protection. And the AMR doesn't respect the silos. It's only our policies that respect the silos. So I would just say that prevention is frankly still the neglected child of our health systems, and the price is being paid by those with the fewest buffers available.
Mm-hmm. You mentioned agriculture and the impacts on food production, and Nancy, I think it links very nicely to you. So I would like also to ask you the same question: which are the most pressing consequences of AMR to animals, to farming right now?
Yeah, I think as earlier said by the speakers, absolutely AMR is here and it's a threat now, and it was already 5 years ago also, and definitely it leads to longer hospital stays, sickness, and sometimes mortalities, and huge economic cost for society. So it's incredibly important. Looking at the animal health side, luckily there we see less mortality due to resistance bacteria yet, but we see big differences in level of AMR between countries. So that definitely is where these national action plans come into play also again. The other thing, what is really promising that we see is because we now reduced antibiotic use in animals by around 50% in Europe. We see also that resistance is going down. So it really has an effect to prudent and responsible use of antimicrobials, has an effect on resistance. And that's a promising thing, I think. Maybe I'll leave it here.
There are many people that might be now surprised to learn that there was a reduction of 50% in the use of antimicrobials in animals. Could you tell us a bit more, like very quickly, how this happened, like with compromises took place, like how did you manage to reduce 50% the use of antimicrobials in farming?
Yeah, so we started working on it about 15 years ago, and we, for example, on the European level, we have APRUMA, which is a platform involving all stakeholders in the animal health sector, really as goal to prudent and responsible use of antimicrobials. So we really focused on that as a sector in the last 10, 15 years. And also we had new legislation in the field of veterinary medicine, but that only came late in 2019, plus also some goals, farm to fork goals. So all of that, I think, made the minds go in the same direction. We have to reduce the use of antimicrobials. we made a lot of guidelines on how to treat different diseases. What Peter said before, what is also happening in the human field. If you have a certain indication, how can you treat it? Are antimicrobials, and again, what was said earlier, we're talking here mostly about antibiotics. Without doubt, antibiotics really needed. And if you need antibiotics, which type of antibiotics? Can you go to the narrow spectrum antibiotics, the penicillins and so on? So focusing on all of that, it was definitely not a work of 1 year or 2 years, but over 10 years we managed to reduce 50%. We're still aiming to reduce more because we want to further reach the farm to go for coal, which is by 2030. We're on the good way, but we still have to go further. And of course, the more you reduce, the more difficult it becomes to reduce even more. But we're very hard working on it as a sector. And like I said before, we see the results of it. We see resistance going down, and that's what we're all doing it for. So that's really positive.
All right, thank you very much. We'll probably get back to that a bit later, but I wanted to get also some like a vision from a perspective that we haven't received until now. So we have been talking about the use in humans, the use in animals, but also one of the main sources of pharma pollution and in the case of antibiotics is the role of pharmaceutical manufacturing. And I wanted to ask Andrea, what role does pharmaceutical manufacturing play in the spread and development of antimicrobial resistance?
Yes, thanks, Eric. And if I can just add one word connecting to the previous answers as well, I also want to say that antibiotic resistance and more broadly AMR has been an issue for more than 20 years. So REACT was founded 20 years ago. We are celebrating our 20th anniversary because there was a lack of awareness and knowledge about antibiotic resistance back then. So it's something that definitely I agree with what was said before. It's been going on for many years, and it's still a challenge nowadays. Also, when it comes to the environmental sector and the manufacturing of antibiotics. Definitely, when we discuss about how manufacturing of antibiotics can affect the development of antibiotic resistance, we need to go back also to the data that we have. And we know that manufacturing facility, especially when it comes to active pharmaceutical ingredients, also known as APIs, are the ones that can be considered some hotspot when it comes to wastewaters and solid waters about antibiotic resistance. And that because this constant efflux of APIs in the water can trigger bacteria to develop the resistance. And as was mentioned before, indeed, then the bacteria can also travel through waterways to trade, food, travel, and just transfer between bacteria as well. If we think about specific data, we also look at what countries are the main producers of APIs worldwide. And we know that India and China account for almost 2/3 of the world API production. But indeed, that's an issue that definitely concerns those countries, but not having geographical boundaries when it comes to the transfer, then we should be worried also in Europe and in any other countries, I believe. The other issue connected to that is how wastewaters are treated or not treated. And also here, we know that around 26% are the wastewaters treated in LMICs versus around 52% globally. So I believe that this is also another striking data that made us think about we need to address the issue both locally and globally at the same time. And perhaps one last point that I can add here is that beside the discharge of APIs into water, we also know that metals and biocides are also triggering, exacerbating the issue of development resistance. And that doesn't definitely help when it comes to the transfer of antibiotic resistance between both bacteria and pathogens as well. So it's extremely important, and maybe we're going to have a chance to discuss it later as well, to go back and look at the transparency or opacity, on the other hand, of the supply chain and see what we can do and looking at those effluents from manufacturing facilities.
And you have raised one of the hot topics when it comes to AMR and the environment right now, which is the role of wastewater. Obviously, it's different, the wastewater coming from a manufacturing site and the wastewater coming from the community. But indeed, it's one of the main sources of dissemination of bacteria. And regarding that issue, there is a new legislation that that has been debated, and it's the Urban Wastewater Treatment Directive. Do you think that it could be effective to tackle AMR in the environment, this directive, especially if it's not watered down with the EPR scheme and these kind of things that have been in the public debate? Well, not the public debate, but in the debate for the last year. What do you think about that, Andrea? And probably later I will also ask Milka, who was interested about this topic as well.
Yeah, probably Milka will be better placed here. But what I can mention is that definitely it's a step in the right direction for sure. But as we know, when it comes to indeed the AMR, drivers are multiples. So I think this is one of the focuses, and it's extremely important to look into that and see how wastewater can affect. And the possibility, I think, what it's tricky to trace back to is actually being polluting those waters, because as you were saying, like they do come from the communities, but they do also come from manufacturing, whether it's the antibiotics or other type of chemicals. So I think that traceability is extremely important, and I think bringing back the transparency side when it comes to managing both in Europe and globally to really trace back to those specific pollutants that we find in the water, I think that will be the tricky part to implement, but definitely a step in the right direction.
All right, Milka, anything to add to this?
Yeah, I also think that this environmental dimension of One Health is really important, and the EU environment law is relevant. And then the things that we have under the Water Framework Directive, like the Urban Waste Water Treatment Directive, Groundwater Treatment Directive, especially for farm runoff, or the Surface Water Directive, they're all very relevant. They all have some provisions for monitoring, but I think the important point there to be to strengthen the treatment and remediation parts in particular.
Mm-hmm. And what I see a bit from my perspective, it's also that AMR in the environment, AMR first is not one of it's one of the big things, but it's not one of the big things that are being discussed right now. Like it's something that it's left, as you said, they called it the silent pandemic, but it's a roaring pandemic. And I think that's something that it's a bit problematic to set it high in the agenda, because obviously we have other health issues like cancer. We had COVID very recently, and I wanted to ask how can we make AMR a priority at the global level, at the national level, at the public health level? And we can start with you, Milka, and then I can jump to Peter and to Nancy as well, because I think it's something that it's a very tricky question that can have multiple answers, let's say. So yeah, please, Milka, go ahead.
How to make it a priority? I would just like to reflect on the challenge, reflect on the fact that we are dealing with fragmented systems, and we have siloed mandates and underfunded infrastructures. And I'm thinking out loud, the fact that One Health is found in the mission letters of 3 different commissioners in the EU, Barheli, Labib, and Hansen, it really hardly helps. So it's really a challenge to make it a priority. No, not to make it a priority, to make sure that it gets the responsibility and accountability that it requires if it's split across the mission of more than one commissioner in Europe. Yeah, how to make it a priority? I think really by the joint action across different sectors. I think we need to use the power. I think you can see my daughter in the background getting into the picture, but that's also technology. We need to use the power of the voices that we have and keep advocating wherever we can along the same joint objectives and lines.
All right, thank you, Milka. I'm going to ask you the same question, Peter. So how can we make AMR a public health priority?
Yeah, thank you. So our governments are facing multiple health and other types of crises at the moment. But first, I think we doctors have a special role in when communicating to people. So we doctors' voice are usually strong, and we reach to many people. And this is a form how we can form what is a priority for a government. But I agree with Milka that the One Health approach is needed. So human, animal, and environmental health should cooperate on the NGO level. Civil organizations should connect. We, for example, CPME has a really good relationship to veterinarians, and we work on this topic together. But for the governments, we have to emphasize and have to make the message clear that AMR should be treated as a threat multiplier that can exacerbate other crises, pandemics, food insecurity. And so the fight against AMR should be integrated into existing crisis response strategies rather than just making a separate one. It's important to consider that countries which spend less, for example, on healthcare, have the chances are lower to successfully fight AMR. For example, there are between European states, there is a 2.5 times difference between the share of GDP spent on percentage of GDP spent on healthcare. And in the poorer ones, for example, the point of care testing, which I just mentioned, is more sparse. It's sparser because that costs money. So that should be also taken into consideration, that the GDP ratio spent on healthcare really influences this fight. Thank you.
Mm-hmm. And I'm going to pick up on something that you said that I think it's one of the keys of this issue, which is that AMR is a threat multiplier. People that are immunocompromised because they are following, I don't know, cancer treatment, for example, or people that undergo surgery, they need antibiotics for these processes to be as secure and effective as possible. And one of the key instruments that we have are antibiotics, and especially last resort antibiotics, which mean that they are the last barrier of antibiotic use. Have you seen an increase in the use of these antibiotics in your practice in human health in the last, I don't know, 5-6 years?
What we see is that the pattern is a little bit different between general practitioners and for example, heavy intravenous antibiotics used in hospitals. And what is clear that in family doctors who have the devices to test for respiratory symptoms, whether it is related to a virus infection or to a bacterial infection, the antibiotic use and AMR drops significantly. So I can strengthen the message which was said previously, that the use of antibiotics or antimicrobiotics can be reduced if we have the tools and if we have clear stewardship and prudent use of them, and we have the tools to check what kind of medication and what kind of compound we need. So that's the good news. But on the other hand, in for example, in hospital settings where the laboratory background is limited, or there is no funding to do tests, broad range antibiotics are used more frequently, and that's the bad news.
Mm-hmm. And same goes for Nancy. Like, can you see a different trend in the use of some antimicrobials in animals?
Yes, absolutely. But before, maybe I just want to pick in on the previous question. How can we keep AMR on top of the agenda? I think what we saw is like we discussed before, AMR is a problem since decades, 2 decades, even longer. But when did it really become on the agenda is with the Jim O'Neill report, looking at the economic impact. So I think we have to keep on looking at that. Also, it's bad to say, but this is something I think politicians look at. What the economic impact does it have? And now that it's competing with many other priorities, I completely agree with the previous speakers. It's really important to look at these priorities, because climate change, all the geopolitical instability, they all act as enhancers for antimicrobial resistance. So we really have to be careful because these overlapping priorities, like with climate change in veterinary field, we see diseases spreading that we haven't seen before, and we have to treat them. If you have geopolitical instability, you have large migrations, you have people with a weaker immune system, all of that, can spread, enhance antimicrobial resistance. So it's really important to keep this very high up the agenda. And it is a cross-cutting issue between public health, food security, food safety, food security, something in Europe that we didn't talk about 5-10 years ago, but now is increasingly more important, and resilient. So we have to keep it high up the agenda. In respect to, do we see, your second question, Eric, do we see a change in the use of which type of antimicrobials? Yes, very much in the veterinary field, because we have the obligation to do antibiotic sensitivity testing before we treat, especially if we want to treat with broad spectrum antibiotics. So that means that we really reduce the use of broad spectrum antibiotics enormously. In some cases by even 80%, and went more to the narrow spectrum ones. But there we have a problem, because the narrow spectrum availability in some countries is really a problem. Like the simple penicillins, amoxicillins, things like that. We have countries where for certain animals and certain indications, they're not on the market. And that goes a little bit back to where antimicrobials are manufactured and the APIs are built, and the limited number of manufacturing units, which are usually not in the EU. So I think that's something we probably share with the human field. And I know with CPME, indeed, we have a memorandum of understanding working on antimicrobial resistance now, I think, for 2 decades already, which is fantastic. But we see many of the challenges, like availability of narrow spectrum antibiotics, that we face in both fields, and this is something that policymakers, marketing authorization holders really should focus on, to make sure we have these narrow spectrum antibiotics on the market.
All right, thank you, Nancy. I'm just gonna take a second to remind all the attendees that they can ask their questions in the question and answer chat, or even they can make their comments in the attendee chat, and I will share them with the speakers. But there is something that I think it's important to highlight, and it's one of the elephants in the room. I would say we are talking about how to make this a priority. And very recently, United Nations General Assembly Declaration has been signed, which, there are some positive sides of it. There are some negative sides as well. I think in the positive sides, well, for example, the environment is one of the topics that it's highlighted as one key topic that needs to be addressed in the next few years. But there is also some negative sides, like, for example, the lack of some ambitious targets. In some cases, the final declaration was watered down from the previous versions, which was a bit disappointing. But the good news is that we have a declaration. And I had the pleasure to be also in New York with Andrea and with Milka as well. And I had a question for you about the compromises that were taken. Is there anything that you missed? Is there anything that you think could have gone further? And we can start with you, Andrea.
Yeah, definitely an important point. I was hinting at that before. And I think taking also a step back from this, we need to remind ourselves that the previous declaration, so the previous high-level meeting was in 2016, right? So there has been 8 years in between, and there are still some commitments that were in the previous declaration that hasn't been implemented yet. So I think the hope from everyone was that last year UN high-level meeting and the declaration was checking back on those previous commitments and further implement and finalize those and move towards some stronger targets. I agree with you in saying that definitely there is some language in there which is extremely valuable and set some looking forward targets. When it comes to specific language, I agree that also in the environmental side, it could have been stronger and there could have been some more addition in looking into the manufacturing of antibiotics as we are discussing today. There is plenty of evidence already out there talking about data that already mentioned how the concentration of those APIs in those waters are extremely high. There was a study last month, I believe, about APIs and antibiotics in water rivers globally. And again, highlighting manufacturing facilities as the hotspots. But I think more broadly, when it comes to also accountability mechanism, as you know, we're also representing civil society. I think it's extremely important that that was stated even stronger and giving really more attention to civil societies and more broadly even community to make those commitments by member states even more accountable. Perhaps something else that I can also mention here is that, again, some targets have been set, and we do have some checkpoints looking forward. So next year, we have the Ministerial Conference on AMR in Nigeria, and the following high-level meeting will be in 2029. But this also somewhat coincides with the SDG, right, agenda and 2030. And this, to me, connects to your previous question in terms of priorities. And we know that AMR does affect the fulfillment of many of those SDGs. So connecting to that is extremely important that we also see AMR under that narrative, that unless we address AMR in all different sectors, it was mentioned before, food security, food safety, and I think it's extremely important, but I think we should also think about poverty, inequalities. Those are, and water, of course, the whole entire water sector, those are all part of the SDGs that will be affected or are being affected right now unless we act on AMR. I'll stop here for now.
All right, Milka, do you want to add anything to what Andrea just said?
Yes, thank you, Eric, and also very, very good points, Andrea. I'll try not to repeat any of those. I liked your point on the SDGs, especially. Fully agree with that. From our perspective, the declaration indeed was a step forward. And yes, there were compromises. You both mentioned the language that was diluted, especially around regulating pharmaceutical pollution, the binding targets that were actively avoided. Also, yes, the civil society got a mention, Andrea, but no structural mechanisms were there. So in principle, from our perspective, what's missing is a solid accountability framework. So one that says who does what by when and with what funding. And also the right to access effective antibiotics as a global health justice issue. It still feels very pharma-centric and very state-driven. But I also wanted to reflect on something that Nancy said before. So she said the more you reduce, the more difficult it is to reduce it even further. And I think we now face the challenge that progress now becomes steadily more difficult and potentially more costly. Because those easiest and cheapest actions have already been taken. So that also has to play into our thinking of how to further keep it on the agenda. I was just thinking, also reflecting on that priority point, it is, so the fact that the geopolitical challenges have entered this discussion made keeping the AMR a priority more difficult. But I'm also thinking it is important not only to communicate about the economic cost of the AMR. I think we need to also communicate about the value of addressing the AMR. And I think in these geopolitical circumstances, it's also important to communicate about the AMR as a security and defense issue, because it is one. So just quickly reflecting on what was previously said, and over to you, Eric.
All right, thank you, Mika. I think it's interesting also to see this perspective of AMR being also a defense issue, especially with the key strategic importance of antibiotics and the weaknesses also in Europe of needing to get those antibiotics from other regions. I think it's a very, very interesting reflection. I don't know if either Nancy or Peter, you want to add anything regarding the United Nations General Assembly and the declaration. It can be a no. So totally fine.
I think I share everything what previous speaker said. But it's extremely important to work on a global level, because we really, diseases do not know borders, and the same for AMR. So we also on the animal health side, we work very much through WOA, the World Organization of Animal Health, who also has made this really a very high priority topic. And they're measuring antibiotic sales all over the world. In the last 2 years, it's decreased by 5% on a world level for animal health. So that's positive. Of course, it's still far away from the 50% in Europe, but 5% is already quite positive. And they also make guidelines. They work on vaccination. They work on biosecurity, things like that. So we have to keep on working globally together on this, because we cannot do it alone as a region here in Europe.
Mm-hmm. I don't know if Peter, you want to jump in? Yeah.
Yeah, thank you. I agree that Europe itself is not, of course, not enough, but it was the EU which has led the fight against AMR over the past decade, and EU must continue to be committed to pursue this path. And I completely agree with all the others that the new impetus should be given to the declaration, to the previous declaration, because we have to keep it in the center of our attention.
Mm-hmm. I wanted to get back to Nancy for a second, when we were talking about measures to reduce antimicrobial resistance, and one of them obviously is also like improving animal conditions and animal welfare. Where do you think we are right now in Europe in terms of animal welfare, and how can we go the extra mile, let's say, to reduce, to improve animal welfare and improve animal conditions in general, and reduce the risk of AMR?
Well, for sure, better animals kept in good health and welfare and improving biosecurity reduces enormously the risk that these animals get sick and also that they need treatments with antibiotics. So it goes hand in hand. And yeah, Europe has one of the strongest animal welfare standards, but still we believe that they should be improved in some areas without doubt. And there also it will really be beneficial if the common agriculture policy would give more investment in better biosecurity, so more hygiene, improved housing, shorter journey times also, because once you start traveling with animals, transporting animals, mixing animals, these are all risk factors, bringing them on markets, are all very much risk factors. So there we really think it would be good if we could further work on that and have more investment for farmers to improve their housing and their management for their animals.
Well, thank you very much for mentioning this also, Nancy, because I find that, you know, having CAP, which is a great instrument to support transition for farmers and to support more efficient ways of farming in Europe and also supporting techniques that can reduce AMR. I'm surprised that it's not one of the central topics of CAP. And it's really something unfortunate because I think we could be doing so much better if antimicrobial resistance was one of the key points in CAP.
One of the important other, sorry to interrupt, Eric, one of the other important points is that we need mirror clauses because animal products are handled on global markets. So we want to keep animal production into Europe and not import products from lower standards from the rest of the world. So that's another really important one.
Eric, can I jump in onto CAP if you don't mind?
I saw you nodding, so I was about to give you the floor.
Good. So we're exchanging signals. I was awarded with a seat at EBA, so the European Board on Agriculture and Food, as the only organization that represents health or public health interest. And I must say, I'm also very surprised that there is very little mention of One Health in general, and in the CAP discussion, I see very little of it. So there is a strong pressure and support from the environmental NGOs and stakeholders to make sure that CAP takes into account the environmental aspects of agriculture, but very limited input on One Health, on the AMR. So I was raising it myself, obviously, but we need more.
Okay, thank you very much, Milka. I don't know, Andrea, I saw you moving, but perhaps it was just you didn't want to. Okay, all right. So I'm gonna start asking some of the questions that the audience has asked, but I wanted to remind you that at the end of the question and answer session, I have a question for you, which is a wrap-up question, and I will ask you to share one concrete action that your sector should take to meaningfully contribute to the fight against AMR. So it's one action. I know it's difficult to select one action. There are many things that should be done, but please think about that because that's gonna be the final question. And I'm gonna share on stream the questions that we have. The first one is from Luna Daye, who asks, what are your thoughts on voluntary initiatives like the AMR Industry Alliance standard? Do you believe that such measures are sufficient? Should they be complemented by mandatory regulations? Probably, Andrea, you are one of the ones that are most interested in answering this question. So do you want to start answering my colleague Luna?
Yeah, definitely. And hi to Luna also that's following us. Yeah, I think that's a very interesting point, because what we didn't discuss today was also that at global level having different type of standards when it comes to manufacturing of antibiotics, of APIs. Definitely having some standard is better than nothing. So let's start there. And I definitely we need to acknowledge the fact that there is some effort. There are some pioneers which are moving towards that direction. At the same time, it is not enough if that concerns just a few of the industries and not, for example, the bigger industries or those that are actually producing the majority of the APIs, without repeating myself, what I said before. Also, I think there are different factors, without going into too many technical details, that can be taken into account when it comes to how do we measure those different factors when it comes to effluents from manufacturing facilities, which can go from APIs, which we discussed a little bit more, but can also be what type of genes, what type of bacteria, and how those can affect down the line the entire One Health approach. There is definitely study done there, and maybe I should shout out to Sweden, where I'm sitting right here, because one of the groups here, Joachim Larsson's group, they're working quite a lot when it comes to antibiotic resistance and antibiotic resistant genes, specifically for manufacturing facilities. But definitely, I do see that there is still somewhat of a gap when it comes to what is produced at academic level in terms of data, and how this data then is taken into account into those type of standards, and then the last step into policy. And I think that's what, as REACT, representing, again, civil societies, but also having conversation both with what's happening at community level, but also having conversation with governments. We represent this middle person, which can bridge this knowledge between science and policy. Because unless we do this bridging of understanding and knowledge, we can't move forward. And I know, perhaps also to mention something in relation to the declaration before that we were discussing, the panel of evidence. So I think that could really be a step forward in making sure that evidence are actually collected, both the ones that are already out there or perhaps new data, but the most important thing, that they are relevant also at political level, because otherwise we're always going to have a disconnect. Thank you.
Mm-hmm. Milka, I saw you also nodding. Do you want to jump in with this?
I agree.
No? Okay.
Can you hear me? Yeah, I'm quietly
actually talking about... sorry?
Sorry, I didn't know if you could hear me. I
Well,
was talking
about voluntary commitments. Perhaps the animal health sector has a different perspective, because I know that there are some voluntary commitments that have been taken at the animal health level, for example, in Spain, regarding the use of colistin in pigs. I don't know if you have a different perspective. Do you think that this is something that in the animal sector works?
Yeah, we've seen quite a lot of voluntary commitments also, both from in countries or from organizations, but also from retailers, and they definitely also play a role and have an impact. But of course, if we want to go Europe-wide, we will have to also have impact cases.
Okay. And I'm going to share another question that we have from Heba Ghazal. I'm sharing it on screen, but it's also for you. It's for you, Nancy. She says that you mentioned reducing antimicrobials in vet medicine. How can we take these initiatives to developing countries?
Yeah, so there indeed, WOA, the World Organization of Animal Health, is taking a lot of initiatives. So first of all, I think what is necessary is legislation, having the basic legislation of the authorization of products and who can prescribe antibiotics, and for that, I think together with CPME, we believe that it's very important that only health professionals can prescribe antimicrobials, so both veterinarians and human health professionals. So not to let them just free in the market. That's the first one. Secondly, education. It was also in the report or One Health education, but also general education of all involved on responsible use of antimicrobials. Because sometimes it just, people don't know about it, are not aware about the difference between different antibiotics, are not aware that there can be transfer of resistance between people and animals and the environment. So having awareness, guides of practice, also good practice guides can also help. All these things, I think, but again, measuring, we have to first measure, because you cannot improve if you don't know where you are. And that's what WOA is doing, all these steps, but it's it's not so easy, of course.
Indeed, it's not easy.
Yeah.
Well, then, if there are no other questions, I will ask you. Please go ahead, Andrea.
Yeah, and I just wanted to add to what Nancy was saying as well, that I worked also before quite a lot in the aquaculture sector when it comes to AMR. So I can also mention there that definitely one of the points to reduce the use of antibiotics to avoid that animal will get sick, right? So the entire prevention part, as was mentioned initially, is extremely, extremely important. So definitely this transfer of infection prevention and control practices, I do see as a key, because if we manage to do that transfer in a proper way, then also the use of antibiotics can be reduced. And when it comes specifically to the aquaculture sector, there have been several ways of also preventing antibiotic resistance, including, for example, vaccinations or use of probiotics, without going into too many specifics here. But I think that part of prevention should be highlighted even more. Over.
Thank you very much, Andrea. I see that there is also another question in the attendee chat from Marina, who said, if AMR is, as some of you have said, a roaring crisis that threatens human, animal, and environmental health, why is it still treated as a secondary issue in climate policy, health planning, and environmental legislation? That's a tricky question.
I can give it a try if you want.
Please.
So my first answer would be that AMR, compared to other health issues, for example, it's not a disease, right? As you were mentioning before, it's not cancer, it's not HIV, it's not TB. So there is a huge, first of all, lack of understanding, as we said before, very much of a technical language, and a dissociation between what's happening, what are the consequences, and what antibiotic resistance represents and is. I think there have been some improvements when it comes to really showing faces of patients, listening and hearing from communities how antibiotic resistance is really affecting them in different type of settings. So giving a face to antibiotic resistance, I think, is also a way to make sure that the issue is brought up to another level, because the WHO has recognized it as one of the major health crises. So that has already been acknowledged, right? But it's actually doing the next step. How can we make sure that we all remind ourselves on a daily basis of the consequences? And at REACT, we always usually show a pyramid, which was done by our founder, Otto Karts, which has all the modern medicine, right? And at the base, there is effective antibiotics. And then you see that when effective antibiotics are not working anymore, this pyramid of medicine that has cancer treatment at the top just falls down. So also reconnecting to this and reconnecting that also when it comes to cancer care treatment, for example, those are not separate issues. And again, I don't want to speak for too long, but infections are the second leading cause of death in cancer patients. And some of those are resistant. So I think there are some key narrative hooks that we can really all say and mention during our speeches. Thank you.
Thank you, Andrea. Anyone else? Yeah, Milka, please go ahead.
Yeah, that's a tricky question indeed. Thank you, Marina. I think the reason we are not treating this issue properly is because it's uncomfortable. Because our policy systems and governance systems are in a way designed for single issue management, not for cross-sector threats. And then AMR as a challenge or One Health really requires that uncomfortable collaboration, that we are not used to. We need a collaboration between health system, agriculture, environment, ministries, between member states and civil society, between regulators and farmers. And that's where I find the challenge is. And I think we really, really need a serious mind shift. We need an institutional change such that we establish one health focal points that are working, that are facilitating the cross-sector funding mechanism, implementation mechanisms. Yeah, I think the challenge, like every other big systems challenge, actually puts in front of us the issue of cross-sectoral collaboration, and I think that's the reason why we are not addressing it properly. We're like in molecular biology, we are still in the place of addressing single gene issues. So I'm just taking an example rather than taking a systems approach or genomics approach.
All right, thank you very much, Minka. So I'm gonna ask you now this wrap-up question, like the one action that your sector should take. And I will start with Peter, Nancy, then Andrea, and Minka. So please, Peter, go ahead.
Thank you. I would also answer a little bit the last question, so Marina's question, because it's related to what you asked and what we think important. It's the key is in education. I think our patients and our politicians, they don't know much about AMR. They don't know what are the numbers, and we need education. And I agree with Mika that we need a cross-sectoral education. So the example I would like to share is such an effort from CPME and FEE, so the Veterinarians Association. We, dating back to 2018, together with dentists and other organizations, we call for the implementation of One Health culture in undergraduate education. But also we collaborated in 2022 to provide information to the public together on the prudent use and disposal of antibiotics. So what I think is which is good as a take-home message is that we need to educate both in schools. In undergraduate level, and also we have to educate the public wherever we can. So even in hospitals, in GP settings, but also when doctors talk to the press, we have to speak to about the AMR, and we have to do this clearly and with words and terms and expression which can be understood to the public. Thank you.
All right. So education for healthcare professionals, but also raising awareness of patients, which we haven't mentioned a lot during the webinar, but they are also a key audience that we need to make sure that can understand also the message of the importance of antibiotics. Yeah, next is, and I think it was Nancy, right?
Yes, thank you. Now, on the topic of education, indeed, we did these joint sessions, which was really very useful. At this moment, the FE is also doing AMR trainings for vets together with farmers in 30 countries. So again, another training initiative. And I think indeed these trainings and education and awareness raising is incredibly important, because in the end we need a sort of cultural, societal understanding of the importance of this issue. And then the politicians will also follow to give it more higher importance. I think one of the problems indeed is that, like was mentioned before, that AMR is so complex. I always think the more I learn about it, the more I understand. I don't understand much. I don't know a lot about it, because it's so complex, and it's so the interactions between other products, between the environment, between the animals, everything is just mind-blowing. And then your question, Eric, the one thing we should do, it's a difficult one, but in the end I chose one because I think it's a relatively easy one. And my relatively easy one on the animal health side is access to narrow spectrum antibiotics. Because like I said earlier, we don't have them available in some countries, which means that that veterinarians have to use more broad spectrum antibiotics, more precious antibiotics, and they are available. So we should make them available and legally also to use, because sometimes they are on the market, but veterinarians are not allowed to use them because they're authorized for another species or another indication, while they also work for the other species or indication we need it for. So access to narrow spectrum antibiotics would be in all countries for all species that needs it. That would be my one, and I think it's a relatively easy one that should be reachable. Thank you.
Thank you, Nancy. That was very, very clear. Well, Andrea, your one action?
Yeah, I'm not sure money will be as easy to be reached, to be honest, but I think it's an important one. And it's definitely going back to the transparency across the supply chain from manufacturing facility. It's extremely important that the public knows how antibiotics are made, what are the environmental standards that have been applied, and to hold those companies accountable for what they say and the product that they come up out of that. Especially when it comes to low middle income countries where, as you know, a lot of the production of APIs is indeed happening there. So in third countries, even though maybe the reselling is happening in Europe afterwards. And definitely for making sure that we address actually transparency, and we address from a One Health perspective, that shouldn't be an option for anyone. So we need to recognize that the way so the antibiotics are produced and where they are produced, it's as important as how they're used. So I'll stop here. Thanks, Eric.
All right, thank you, Andrea. So we have some interesting words like education, access, transparency. Milka, it's your turn. I've put you in a very difficult situation because all these topics are very, very relevant. So please go ahead.
So how do I add to it? I think I'll try by going back to Marina's question. So if I would have to pick one action that IFA would take now, it is that we would push to turn One Health talk into the actual systems change. And that means actively connecting the dots between health, agriculture, and the environment, so that policies stop being developed in silos and actually reinforce each other. So through our Node Connect project that has just recently started, we are mapping influence, empowering civil society, and helping policymakers. So back to Peter's education point, that AMR is not just, and Nancy's, not just about microbes. It's about governance, it's about equity, and it's about getting the fundamentals right across the sectors. Over to you, Eric.
All right, thank you very much. Well, thank you to all of you for today's time. I'm gonna call on a stage my colleague Ginebra, who will wrap up the session and share some take-home messages. But thank you very much for being with us today to the 4 speakers.
Thank you for having us.
Thank you very much, Eric. That brings us to the end of today's webinar. Once again, thank you so much to all of our speakers for their insightful contributions and reflections on this important topic, and to everyone who joined us today. Today's discussion showed us that tackling AMR requires real coordination across sectors. And I will try to wrap up the most important points raised by our great speakers today. What we heard clearly is that AMR is not a silent threat. It's roaring, and it's hitting the most vulnerable first. Yet our response remains fragmented. One of the most urgent challenges that has been raised is the lack of coordination in national action plans. Despite recognizing AMR as a One Health issue, our policies still operate in silos, while resistant bacteria move freely between humans, animals, and the environment. From the animal health sector, we heard that the solution starts with reducing unnecessary antibiotic use, and promising progress is already underway. 50% of antibiotics in animals have been cut, thanks to guidelines and good practices. But to go further, we need investment in vaccination, biosecurity, and better animal welfare. This also means supporting farmers with funding and implementing mirror clauses to avoid importing lower quality products that undermine EU standards. From the public health and civil society sectors, a clear message emerged. AMR is not just a technical challenge, it's also a communication and political one. We need to shift the narrative and use language that resonates across different audiences, making AMR understandable, relevant, and urgent. It's about equity, environment, and public health, all currently paying the price of inaction. We were also reminded that AMR continues to compete for attention against other crises like geopolitical, migration, and climate change, but all of which, ironically, amplify AMR risk. The pharmaceutical sector plays also a critical role too. We must tackle antibiotic manufacturing pollution and address inefficient wastewater treatment, as well as the transparency of the supply chain. Acknowledge also the overlooked role of heavy metals and microplastic in driving the resistance is also very important. On the healthcare perspective, we heard that antibiotic stewardship can significantly reduce the need for antibiotics, even if in many sectors the overuse continues. We also look at the UN General Assembly Declaration on AMR, and we welcome the inclusion of the environment, but disappointment still remains. The declaration lacks concrete targets, and civil society role needs to be improved. We now look ahead to the ministerial meeting in Nigeria next year, where we must push for stronger commitments. And finally, we heard that education is key. We need to raise awareness among the public and ensure that healthcare professionals are trained to understand and explain AMR clearly. If people don't understand the problem, they can't be part of the solution. What's also emerged from our conversation is that the environment connects all these sectors. It's where AMR travels and spreads. That's why we need policies that reflect this shared responsibility and take a truly One Health approach. To truly make progress, we must break down silos. We need policies and action that are collaborative and cross-sectoral and grounded in the implementation of the One Health, one that brings together all relevant actors, including the environmental sector, in both design and delivery. Let's keep working together to turn One Health from an idea into real action to truly address this roaring threat. Thanks again to everyone, and I wish you a great day.